Hi, I'm Dr. Anthony Larson, and I'd like to talk for a minute about taking care of your teeth during pregnancy, or what to expect with your teeth while you are pregnant. Many of my patients have commented that they had great teeth until after they had a baby. Why is that the case? Well, there are several potential reasons that has happened, and some are pretty simple to understand. For example, if an expecting mother is very nauseated and is having a hard time keeping food down, is throwing up a lot, there's a lot of acids in the mouth. It's also very difficult if you're very nauseated to brush your teeth thoroughly and to floss. And so I always just tell my expectant mothers to do the best you can. If you are vomiting, you'll want to rinse your mouth out with water as soon as you can afterward. You want to do the absolute best you can to brush with a fluoride toothpaste, to floss as you're able. Just do the best you can in taking care of your teeth, but it's true that moms make many sacrifices for their babies, and sometimes tooth hygiene does take a back seat during this time. Now, I will mention something about bleeding gums. Bleeding gums are very common during pregnancy and do not necessarily indicate disease. If you have had healthy gums in the past and you're keeping the same hygiene routine, but now you're expecting and your gums are bleeding a lot, this is most likely due to hormonal changes within your body. And once the baby is born, the bleeding gums will stop. The one thing that you do need to do is keep brushing and flossing, even though there's a lot of bleeding going on. If you see that your gums are bleeding and you stop brushing and flossing, then you will get gum disease. But if you will brush and floss despite the bleeding, then bleeding will resolve and there's probably no disease that needs to be treated. One last thing I will mention about gum disease and pregnancy is that it is thought to be not healthy for you to have chronic gum disease while pregnant. So if you're concerned about your gums and the health of your gums and you're thinking about having a child, I would recommend seeing a dental professional and having your teeth cleaned thoroughly before. If you are expecting and concerned about that, it's totally appropriate or safe to have your teeth cleaned during the second or even third trimester of your pregnancy.